Many things, as you know, can change your INR: diet, alcohol, new or any changes in your medications. This includes over-the-counter medications and herbals. Any vitamins and supplements, some of those can also affect your INR, and then illness or infection has the potential as well. So another challenge, do I need to change my diet? The way that warfarin works, it's basically inhibiting vitamin K from producing those clots, those factors in your body that produce clots. So when you eat foods that are high in vitamin K, they do have the ability to decrease your INR because you're giving vitamin K back to the body. Typically, we think of green leafy vegetables. Liver, mayonnaise actually has a pretty high level of vitamin K. A lot of oils can. In this resource outside, there's a great list of vitamin K content in foods, and I've also provided a website there for you where you can put in what you're eating and the vitamin K content comes up. The key point here is that tip number 4 is you have to keep your diet consistent. You do not need to necessarily avoid all of these foods. You don't have to stop eating spinach or your salads, but you have to try to be consistent. We really see changes if you don't eat, let's say, spinach, you never eat it, and then all of a sudden in 1 week you eat spinach every single day of the week, your INR will drop. But if you keep your diet consistent, our job is, again, to titrate the warfarin dose to what meets your needs. Additionally, there is some data that having a small amount of vitamin K in your diet can improve and make your INR levels a little bit more stable. So at times, even for patients who have very fluctuating INRs, and I was thinking about this for you guys, there is a little bit of data that says if you give a very, very low dose of vitamin K every day as a supplement, that it can potentially help stabilize your INRs. Alcohol will interfere with your liver's ability to break down warfarin, and it can increase your INR. Generally, drinking more than 2 alcoholic drinks in 1 day can increase your risk of serious bleeding while on warfarin. So if you drink warfarin, again, open communication with whoever's managing your warfarin therapy. Do not drink in excess, and try to keep your weekly intake somewhat consistent. Tip number 5, how can I help keep my INR in range? We know that all of these different things can affect your INR. The number 1 thing is open communication with whoever's managing your warfarin therapy. This is not an area to keep secrets or, yeah, I had 3 drinks the other day, or, just be open. And again, the healthcare provider will make treatment decisions and adjust the dose based on your lifestyle and what you need. Also, again, I mentioned prescription medications, over-the-counter medications, herbals, over-the-counter, so cough and cold medicines, pain relievers, stomach remedies, all of those types of things. When I say over-the-counter, that's what I mean. Communicate those as well if you begin taking those, or if you were taking them and then stopped them. And then I mentioned patient self-testing or self-management is essentially when you test at home. This may be an option, and if it's of interest to you, you can talk to your provider. Challenge number 4 is dosing. And again, this is particularly for the for warfarin. The newer agents are a little bit less complicated in that there's pretty much 1 dose that you take. So in terms of warfarin, what dose do I take? My dose might change. What does that mean? What time of day should I take my warfarin? I encourage you to keep track of your doses and keep track if you actually took the pill. Again, this was something I set up for my mother. I printed out a blank calendar and I gave it to her and I said, here, you need to write down your INR after every appointment, write down exactly what doses you took. If you missed a dose, keep that on the calendar, and then you can have that conversation with the healthcare provider. So a calendar, keeping notes if a book works for you, if there's a program on your computer or your smartphones these days have all sorts of apps, which we'll get to in a minute. But keeping track of that dosing, I think, is very important. Challenge number 5 is picking up the appropriate prescription. And I encourage you to talk to your pharmacist, ask questions when you are picking up your actual prescription. And this includes, to that provider, also communicating your entire medication list. Especially if you use different pharmacies, it's important for that pharmacist who's dispensing that medication to know all of the medications you're on, all of the herbals, all of the over-the-counter medications. Some herbals can actually thin your blood as well, so if taking those with a prescription blood thinner, you may be at an increased risk of bleeding. Sample medications. So I'm not sure, I think this practice has gone down a little bit, but if you are given samples by your physician and you're taking those, there's no good system to keep those in line with your medication profile. The pharmacist will have absolutely no idea you're taking a sample medication. So be sure to communicate that. If there's any change in your medication, so if your provider told you to stop another medication, an antibiotic, if you're on a blood pressure medication and they said to temporarily stop it, any type of changes should be communicated to the pharmacist. And then I just wanted to mention cash payment for generics. There are a lot of pharmacies now that do this $4 generic plan, which is wonderful to save money. But again, if you're getting that prescription at a different pharmacy than where you get your other prescriptions, you need to communicate that. And also, if you're paying cash for that $4 generic, it may not, if it's not going through your insurance, it won't produce a claim. So sometimes providers don't see that you're taking that other medication. Communicate any allergies to your pharmacist before you take that prescription and go home. And then also let them know if you do have any trouble swallowing pills, reading labels, remembering to take your medications, opening the bottle, or paying for medications, because pharmacists do have a lot of tools to help with those as well. So before you leave the pharmacy, ask the pharmacist questions. Like you're going to ask everybody questions. Ensure that you know what it's for. What do you do if you miss or forget a dose? Will this take place of anything else I'm using? Especially if you make a switch. I had one patient who came in. She was taking warfarin, and when dabigatran or Pradaxa, the new agent, came out, her provider prescribed that. She didn't realize it was to substitute the warfarin. She was taking both agents, came in with a GI bleed. So be sure that you know, particularly if things are changing, what it's for. Where and how should you keep this medication? Some of the new Pradaxa, dabigatran in particular, which right now it's only being used for stroke prevention and AFib. But if that medication in particular has to stay in its original bottle, so sometimes there's a little bit of strange caveats with medications. And then where can you find more information? So these are all questions you can ask the pharmacist. The other thing to do before you leave the pharmacy is to look at your prescription. We're all human, we make errors, and a lot of the times patients are the ones who discover errors before leaving the pharmacy. Be sure that you do have the right medicine. Does the brand, generic name, does that sound correct? Do the pills look very different than your last prescription? In terms of warfarin, regardless of what brand generic you're on, every dose tablet has the same color. So if you know that you take the 5 milligram tablets that are peach color, regardless of which generic or brand you get, that 5 milligram tablet should be peach in color. Be sure that you know the right dose for the medication. And then a tip this tip's actually from my mom. She said to buy a pill splitter. Especially if you're on warfarin, and I thought that was actually a smart point. So she was never told that. A week after, they were doing the dose titration, and she had to start splitting pills. So make sure you have a pill splitter.